being there.
I'm Cindy Solesbee. I'm a healthcare navigator from Mountain Projects out of Waynesville. And our director, Patsy Dowling, applied for a grant in 2013 to hire us navigators to be in the furthest most western counties of North Carolina, in the most rural areas, to help folks get through and sign up for affordable health care. So, and she came to that conclusion that she wanted to do this. A big motivation for her is that she found out that there were approximately 30,000 uninsured in the far western counties of North Carolina. So we have a navigator here in Macon, me, and we've got Clay, Cherokee, Haywood, Graham, Jackson, and Swain. And what I do is I help people get through the application. We apply online or on the phone. And really what you're applying for are premium tax credits or subsidies. That's what really makes the insurance affordable. Not only are the premiums that make the insurance affordable, but there's also cost sharing reductions, which means if your income is within a certain amount, you pay less for co-pays, deductibles, and your co-insurances. So the least I've seen for Blue Cross Blue Shield is like a $5 co-pay to see a doctor instead of $25. Oh, okay. Or $10 instead of $50 to see a specialist, and $500 deductible instead of $3,000. That's the best I've seen. So this truly makes it affordable for people, and especially people that I see who've never had health insurance before. Now they have it. So this Affordable Care Act provided protections for people, for consumers, that they've never had before. It prohibits premiums going up because of bad health or your gender. Typically women pay more for health insurance. It extended coverage for young adults until age 26 on your parents' insurance, which is really important. We're talking about mental health and young people and substance abuse and the things that they experience at a younger age. And this is really important for them to be able to stay on this insurance. It has to cover people with pre-existing conditions. So typically we don't think of mental health being a pre-existing condition, but it is. And so if you had a substance abuse or mental health conditions, now you don't have to worry about that, you're covered. And it eliminated annual limits and lifetime limits. There used to be a limit on your insurance that would say we'll only pay out $10,000 a year or $1 million over a lifetime. Those limits are gone. There are no more limits. There is a limit as far as how much you pay out. The lowest limit I've seen in an entire year is $700. That means that all your co-pays, your deductibles, your co-insurances go towards that amount, and you're done, no matter what happens to you in a plan year. I had a friend who was in an ATV accident. It flipped over on her, and she was put in the hospital. She was in the hospital over 2 months, and she had 2 brain surgeries. And then she went to Care Partners and got therapy. But her bill, I know, must have been over $1 million if you're in, the hospital that long with that care. But $700 was the most she paid. She's a farmer, and her husband didn't understand the insurance, and he thought that they would have to sell their farm, literally. But they didn't, thankfully. Now, these plans have to cover a minimum essential benefits, and these are outpatient services, emergency services, hospitalization, maternity and newborn care, and this is important, mental health, substance abuse, behavioral health treatment, prescription drugs, rehab, labs, wellness management, chronic disease management, and pediatric services, including dental. Now, these, it used to be insurances either would not cover mental health, or if they did, they would only limit it to like 10 visits a year. And now, due to the Parity Health Protection Act that was passed in 2008, insurances, when they offer mental health, it has to be on an equal level with physical health. So in other words, in the instance of like co-pays, they have to have equal co-pays. So in other words, they couldn't charge you $40 to see your psychologist and $20 to see a doctor. These have to be equal. And they can't limit, as I said before, they can't limit the number of visits that you go to for your mental health treatments. So it's like thinking, what if they limited your treatments for high blood pressure? I mean, that doesn't make sense. So now, mental health issues are on the same level. So let's see here. I'll go fast here. All right. Okay. Let's see what else. Okay, another great benefit for this insurance is preventive care and that pocket cost. And part of that is screening. So you have screening for alcohol, substance abuse. These they can screen at the very first, no out-of-pocket cost whatsoever. So that makes it very affordable and encourages people to get us. So right now we're open enrollment is closed, but we have special enrollment periods. So those for people like you have a life change, like you get married, divorced, you have a baby, you leave incarceration. That's a special enrollment period. So there's all the. If you know of anybody that might fall in these categories, please take a client. And I'd be glad to help them. Thank you so much. People think I sell insurance. I don't. I don't get any commission. My commission is knowing that people are getting covered, and you can't put a price on that. Thank you so much for having me here.
They did great, didn't they? This is wonderful. I want to thank the panel.